Hey guys, it's Dirk again here. Today is 7 days post jaw surgery. Um, I feel pretty good today. The last time I made a video it was day 3, and things have definitely gotten better since then. I'll just talk about my pain right now. Pain is on the low end of the numerical scale, like 2 to 3 out of 10, but it can go up to 4 or 5. For me, I haven't had any narcotic today, and that's codeine that I had. Um, I've just been using Tylenol and ibuprofen today. I had Tylenol 650 milligrams at 8 in the morning, and then I had ibuprofen 400 milligrams at around noon, and then I took Tylenol again just at 4 o'clock-ish. So, pain is being managed without narcotics right now. I still have pain though, and mostly it's kind of like a headache feeling. Headache kind of across the top and then at the temples. And I think the temples are more to do with muscles, because I probably quite tight in here, and I kind of, I don't know if it's pulling down or whatever. I also have pain, and it's really like pressure, as if your head's being squeezed all across here. And then I have sore spots on the sides, obviously where they cut the bone. But this probably isn't so bad. This is annoying, and then the headache is annoying. Just want to talk about other things. I do have random, and it's not as bad right now, it was worse in the first few days, random sharp shooting pain to teeth. Random teeth in my mouth, all of a sudden I get a sharp pain, and then it goes away. Yeah, that's about my pain right now. I really wanted to get off of the narcotic because it just didn't make me feel very good. So, swelling is getting better, but it's really slow now. It seems almost like it's kind of at a stable point. What I think it is going down, but the left side of my face is definitely more swollen than the right side of my face, and maybe they just did more work there, but looking at old pictures of myself, this side of my face actually seemed a bit bigger, so, you know, whatever. If it's not perfect at the end, it doesn't really matter to me, as long as my mouth is working appropriately. But, you know, swelling is going down, and I think that I'm pretty good for my swelling. I mean, it's obvious, and so you can see, you know, right there is really obvious, and then this side is definitely worse. And you know, it's just really tight in here, but my mouth I'm able to move a bit more. The only thing is that it hurts, especially right here when I do anything, because I have a stitch there, so the stitch is painful, especially if I laugh or smile. Oh my god, I saw a funny video a day or two ago, and I couldn't stop laughing, and I actually started crying because the pain was so bad, but I couldn't stop laughing. And I like to laugh, so it's been hard not to be able to laugh and smile and talk. Uh, what else? Numbness. So, I think I got more feeling here. It's still kind of numb, but I think it got better in the last few days. Numb, I'm kind of numb on the nose, and then it just feels weird, this whole part, and then top lip's a little tingly. My full bottom lip, especially here, feels like it's burning all the time. It feels like a burning, but and I can kind of feel that, but not really. It's still pretty numb. Sorry for the. It's just the saliva builds up. My chin is basically this whole part is numb, really, to touch. I can't. I kind of now, like, I could tell, ooh, there's something going on there, but really, it's numb. But the last few days, I have had this itchy, I think this right here, really itchy, sometimes all this whole part itchy, or burning, and then you can't scratch it because you can't feel anything. So it's just usually doesn't last too long, maybe a minute or two, but it's bizarre. And I'm starting to get some tingling and burning here as well. So I think I'm gonna get back, definitely my lips, but I think I will have a little numb area here. But even, maybe I could cut. It's hard to tell when you touch yourself because, anyway, it's hard to tell. Yeah, I feel everything under my neck, everything on the side. It's just a little here, it's a little weird, but I'm impressed. I'm happy with that. It's still, it's only a week, so I trust it'll come back. My energy levels, really, I feel pretty good. I think the thing is, when I get up and move around more, then I get a headache. So then, that's kind of what's limiting my activity, but my energy's really good. And I actually saw my hemoglobin level before, and it was higher than normal, so I know even if I lost some blood, I know that I wouldn't be anemic. And he said I lost about a can of Coke, a pop can full of blood in total, so I'm lucky that way. And yeah, energy's pretty good. I mean, it's definitely crucial that you have someone helping you the first, I'd say, 2 or 3 days after you're out of the hospital. But then after that, I think you can really, if you're feeling okay and everything's going okay, you're good to be on your own. Really though, it's just a nuisance to eat, drink, do your medications, especially in the beginning, because you're taking a lot more. And then, cleaning your mouth, and then cleaning all of your syringes after you eat. And it's all just a big process, so in the beginning, I was, every 2 hours, I was doing something. Taking a medication, or you're supposed to rinse with saline every 2 hours, even still now I'm doing that. But you know, it was just a lot, so just to have someone to kind of clean up after you do everything, that's really helpful. But if you had to be alone, you could definitely do it. I've been really lucky to have a lot of help from my mom. She came and stayed right now, because my girlfriend's working full time, so it's been really helpful. But if I had to, I definitely could do it all on my own. But for the first 2 or 3 days, definitely have someone with you if you can. Talking about eating and drinking and all that, my mouth right now is gross. Not really bad. I don't have bad breath that I can tell. But yesterday and maybe the day before, I started getting this film. This gross slimy film on my tongue and inside my teeth. And they tell you to rinse with the saline and use your tongue to brush inside your teeth, but it doesn't really work. So it's just really gross. I can't wait to brush my teeth inside and my tongue. Yeah, it's just gross. It's gross. I tried saline. There's a mouthwash that was prescribed, chlorhexidine. I use it 3 times a day. It's blue, and that kinda helps, but it's just the inside. I have a baby toothbrush that I use, and this, I just go on the outside. I can go down my cheeks now, but for the first few days I wasn't. I started this maybe a day or 2 ago, and using the chlorhexidine, I just brushed the teeth. I had no sensation on my gums. so I can't feel my gums. Yeah. So you have a couple big syringes for food and water and saline rinse, and then smaller ones for your medications. Speaking of medications, liquid Tylenol, it's been awesome, or acetaminophen. Ibuprofen, really important as well. This is the codeine liquid, and it tastes disgusting. The flavor, I don't know what they tried to flavor it as, but it makes me want to puke. So, I don't like the codeine at all. It's disgusting. Ugh, it's gross. Boy.